Good morning, Dr. Burgess. Welcome. Thanks for taking time to speak with us today.
Sure. Glad to do it. Thanks for having me on.
Yeah, you've got an incredible amount of experience and you're really at the forefront of healthcare and policy. One of 14 physicians currently serving in the House of Representatives. But most importantly, you've really spearheaded a lot of the key provisions in the Century Cures Act. And we wanted to start off with that this morning because Sunday is the 4th anniversary
Mhm.
of Century Cures Act, and you were one of the main authors there, which is really critical to the work of the eHealth Initiative and Foundation. You were a main author of the information blocking and interoperability provisions of the law. And I'm just curious how you feel right now in terms of have we made progress there in terms of reaching interoperability since passage? Where do you think we are on that journey? We know it's a long journey.
There's been progress. It's been glacial in its approach. But look, actually, I started on the issue of interoperability several years before Cures came along, and Cures became a valid vehicle on which the interoperability portions could proceed. But it it actually all began when I was doing an event for another member and speaking to their hospital staff section. And this is a long time ago, but the stimulus bill from 2009 had passed. It had the provision in it for providing electronic health records. It was kind of slow to roll out, but eventually did. And when I spoke to that medical staff section, it was either the CIO or the CFO of the hospital up in Ohio who said, "Can you help us because we we get sold these systems by vendors, and then the actual performance is nothing like what we were promised, and we've got very little recourse." And I said, "Well, can you give me an example?" And they said, "Well, none of these systems will talk to each other. So we have these very expensive siloed data repositories that are simply not working." And while I hadn't been a big supporter of the stimulus bill in 2009, and I did wonder about the wisdom of putting the electronic health records title into the stimulus bill, nevertheless, if Congress has passed a bill and put money forward, it at least ought to deliver on some of the promises, and at the very least, it shouldn't make people's lives worse. But that did seem to be a risk. That did seem to be what, again, this hospital executive was telling me. So, really starting at that point, trying to work on what were the obstacles, what were the reasons why the data blocking was occurring, what was preventing a doctor in a doctor's office from being able to access the results of a CT scan done in an emergency room across town or in another county the night before. These were the kinds of problems that initially were out there that I was trying to address. And it has evolved some over time. The good news is that the language got incorporated into the Cures bill. It did get passed and signed into law in December of 2016. It took a long time for the Office of National Coordinator of Health Information Technology to come through with the rulemaking. And then I guess that was about 1 or 2 Decembers ago, and then it landed right in the middle of the pandemic, so that put an additional pause on things. Obviously, it's a big day today. I think the vaccine's going to get the emergency authorization from the FDA, so I see light at the end of the pandemic tunnel, and we need to get on with the work of making certain that the congressional intent that was there in delivering this interoperability requirement in the electronic health records world, that actually becomes a reality for people.
So you mentioned the pandemic, and I think, we've done a number of reports this year on COVID-19 and issues around interoperability and social determinants of health and using, technology systems and analytics to identify at-risk patients and et cetera, as well as for vaccine distribution and development. You know, COVID has certainly highlighted a lot of the issues and interoperability issues that still need to be addressed when it comes to the exchange of health information. How do you think Congress can, during this pandemic and hopefully after, continue to support the modernization of public health systems? And what do you think is going to be possible in the next Congress, given the shift in power?
Well, we don't have to wait till the next Congress. Just yesterday, there was a technical corrections bill to the interoperability title of cures that was passed that would allow the Inspector General Inspector General of HHS, Office of the Inspector General, to enforce some of the provisions that prevented data blocking. The agency felt that additional language was necessary, that they didn't have the authority to do the things that they felt it necessary to do. So that was the reason that the technical corrections bill came through yesterday. I just use that as an example because look, and it's not just with interoperability. There are a lot of big things that happen in the Committee on Energy and Commerce. We do some big things. And I'm not of a mind that we always get it right, absolutely right, when it leaves the House chamber and goes over to the Senate and then down to the White House to be signed into law. It is important for us to revisit these big things from time to time. Did we get it right? So yesterday, this technical corrections bill, people say, well, that wasn't really there were no headlines from that, but the headline is that Congress passed something that I felt very strongly about. I thought this was in the best interest of patients and doctors, and it didn't quite measure up. And the agency said, we need some additional language, and Congress, the committee, needs to be willing to provide that when indeed that request comes in. Do the hearings that are necessary, ascertain that you don't want to pass a regulation just for having a regulation, but if there is truly a problem with delivering on what the promise was of the legislation 4 years ago, sure, we should be willing to relook at that, and if it's necessary, to provide some technical updates. And then, of course, the other thing is, this is not a static process. The world from just the technology standpoint is not the same as it was when the American Recovery and Reinvestment Act of 2009 passed, and even when the Cures Bill passed 4 years ago. The technology rapidly advances, our state of knowledge rapidly advances, and we in the legislative branch of government need to be adaptable enough and flexible enough to provide we just need to be agile enough to provide what is necessary. If what we did 4 years ago or 8 years ago or 12 years ago is no longer operational, we need to be able to quickly provide the inputs necessary to make it work or to repeal it.
That's so important that you're willing to kind of go back and tweak and make those additions and corrections to get it right.
Which I would also add is why it is important in some of these big things that, yes, you can pass something out on a party line vote, but there are going to be difficulties encountered down the road, and it is more straightforward to correct or to influence those difficulties if actually you have people who participated from both sides of the political divide, if you will. There needs to be ownership from both political parties, and so that there is a willingness. Since there's ownership of both sides, there needs to be a willingness I think that enhances the willingness of being willing to correct whatever deficiencies have been identified.
And it's great that you mentioned that, kind of having a bipartisan in both parties on some of these issues. So what do you think, is possible to be next in terms of interoperability? And then another issue that's close to us is health privacy, as we've worked with the Robert Wood Johnson Foundation on looking at consumer privacy as well. So do you think that it's possible for Congress to address something along that vein next?
Yeah, I do, and it has been difficult. We've actually, the privacy discussions have gone on the entirety of the time that I've served, And sometimes it does seem to be refractory to a solution. But I think as you just witnessed the advancing complexity of what we're able to do and how our information systems are designed to respond to that, providing the protection for the patient, for the consumer, with the right kind of privacy provisions that also do not that don't work at cross purposes to delivering the best care to a patient. It's a trick. It is difficult, but it's important that we do that. Several years ago, when I was chairman of the Subcommittee on Commerce, Manufacturing, and Trade, we did a bill on data breach notification that I thought was the correct approach. It was sort of technology neutral, recognizing that we weren't going to be able to know all of the newer technologies that we're going to develop with the passage of time. Did require federal preemption, and that sometimes gives people pause. They want the states to be the sole arbiters, but as I argued at the time, I thought the internet was why the founders wrote the Commerce Clause into the Constitution, because they knew one day we would be able to seamlessly electronically go from state to state without having to stop at the border and adjust our regulations. So it makes some sense that the privacy legislation that comes forward, yes, there is going to be the necessity that it works seamlessly throughout the country. And then I've also felt pretty strongly that there needs to be a light touch with as far as the liability issues, and that people are going to be less eager to adopt things if they worry that, oh, this is going to end up with a lengthy and involved and expensive experience in front of the plaintiff's bar. So those are kind of the two competing influences that we dealt with on data breach notification. We did get a bill through the subcommittee and the full committee. It never made it to the floor, but I think that type of template is one that I would be very interested in working on it. And in fact, when we did the data breach notification bill, it was in fact bipartisan. Difficult because the competing influences of perhaps the two political sides, but at the same time, it is possible to come to an agreement and have something that is in fact workable and provides the correct layer of safety for patients and for doctors involved in patient care. But it is going to be so critical that we get that right. We can in fact inhibit development and actually push things in a less than positive direction if we're not careful about how we construct that.
But that is wonderful that you do have hope that that's something that could possibly happen in the next Congress. So that's really great to hear. Yeah,
I've had that hope since 2005. So the hope has been there. And look, this is hard stuff, and people feel very passionately about what they feel passionately about. And the correct approach is, in my opinion, is there need to be pretty fulsome hearings and do hear the arguments from people who may not agree with you, but we are going to have to come to a conclusion. And it's not even just an issue of interstate commerce. It's a question of being able to compete in the worldwide stage, which we all know is becoming increasingly necessary. So it does no good for us to decide here what is going to be best if it is not operational in other markets around the world where it's going to be necessary.
Well, thank you so much for your time this morning. We really appreciate all the hard work that you've done over the years, and look forward to working with you in the future. Thank you.
All right, good deal. Thank you very much.
Have a great day.
Bye-bye.
All right, thank you so much.
All right, well, I hope it was